Konnichiwa! How's it going, everyone? My name is Melanie Tomlinson, and I'm a registered early childhood educator and student at Brock University, here to talk to you a little bit about autism spectrum disorder through a Pecha Kucha style presentation. So what is it? Autism spectrum disorder is a neurodevelopmental disorder that impacts brain development. Most individuals experience communication problems, difficulty with social interactions, and a tendency to repeat specific patterns of behavior. Did you know that autism can sometimes be detected as early as 18 months? Make sure you bring up your concerns as early as possible with your family doctor. I'd recommend choosing a doctor that knows how to use a stethoscope. Now let's take a look at some early warning signs of autism in babies and toddlers. Some things you may notice are limited or no eye contact. They may not respond to their name when you call them, or they don't show any interest in games like peekaboo. Some early warning signs in young children and adults may include behavior and social challenges. This includes aggression, you may see property distraction, or they may have the inability to form friendships. Another important early warning sign is difficulties with eating, sleeping, and toileting. Many children with autism have gastrointestinal issues that can give them diarrhea, bloating, and gas. Pretty poopy, eh? Chicken nuggets. Time for a knowledge nugget. Every person that has autism is unique. The early warning signs are different for each person on the spectrum. As the saying goes, if you've met one person with autism, you have met one person with autism. Autism's prevalence rate in Canada is every 1 in 66 children. That includes 1 in 49 boys and 1 in 189 girls. This means boys are at least 3 or 4 times more likely to be diagnosed than girls. If you are an educator, the odds are pretty high that you will have a child in your class at some point with autism. It is essential that we have knowledge of autism so we can provide a safe, supportive, and inclusive learning environment for all of our children in care. Here are some essential facts that every educator should know about autism. Number 1, autism presents itself with insufficient communication. This means a person may be nonverbal, have delayed language development, or repeat words and phrases. Number 2, children with autism are highly dependent on routine and do not like change. They may need some help with adjusting to changes in their day, such as staying inside for recess due to the rain. Imagine if you didn't get your coffee in the morning, how you would feel. Ugh. Number 3, children with autism exhibit sensory issues of some sort. This can include sensitivity to noise, smells, lights, and textures, and even on their birthday. Number 4, children with autism can have difficulties with social skills. For example, the child may not be interested in social interactions or know how to play with other children. With proper supports, they can make significant progress in this area. Bah! And last but not least, safety. Children with autism may not be able to identify situations where they may get hurt, such as crossing a road. They may also not have any fear of heights. Who's there? You are! Yay! So glad you're still here with me. Time to get a pen and paper and make some notes. You don't want to miss these teaching strategies. Oh, and don't forget your positive attitude. It goes a long way to support inclusion in the classroom. First and foremost, get to know the child with autism and their family. Remember, they are a child first. What does a child like to do? What are their strengths and needs? Do they use any assistive technology? What are their skills? Next up, visuals. It is essential that visuals are used in a classroom as children with autism tend to be visual learners. Seeing it helps. A few examples may be choice boards, social stories, or a daily visual schedule. Create an inclusive environment with minimal distractions. Keep your activities that you're not using out of sight and minimize what is on the classroom walls. Also, include a quiet space with calming objects that children can go to if they need a break. And this one, I cannot stress enough. Keep it simple. Children with autism often have challenges with processing oral language. Keep your instructions short and to the point. Use words such as first and then. First, I'd like to say a few words, and then you can enjoy this delicious popsicle. Thank you so much for hanging out with me. I really hope that these tips and strategies helped you to gain a better understanding of what autism spectrum disorder is. All the best in the future. Bye-bye.